Obesity. It impacts more than 106 million Americans, and with the holidays approaching, it is still possible to manage your weight. I caught up with board-certified surgeon Dr. John Olsofka and his patient Aisha Neal to learn about the risks of obesity.
Obesity is certainly a state of being overweight, and we define obesity by using a calculation called a BMI. And that takes a person's height divided by their weight in a formula that comes up. And so obesity is defined as a BMI of greater than 30, whereas morbid obesity is a BMI greater than 40. And certainly the risk of obesity, such as the comorbidities, such as diabetes and hypertension and cardiovascular disease, are why this is such a serious health problem.
And if you are dealing with obesity, there are also costs that are going to be associated with this. Can you touch on that a little?
Well, certainly, yes. Just the cost of the medical treatment per year. It's been shown that there's a significant increase in individuals' medical cost per year, as well as to our cost in general to society. I think it was $147 billion that's spent on obesity treatment in this country alone.
Wow. Okay, so then what are some small changes that folks can make that could potentially make a big difference in their lives?
Well, I think the first change is a commitment to change. If you keep doing the same thing over and over and kick the solution down the road, then the problem increases. But something that a patient can do right away is consider limiting or eliminating high-calorie drinks, such as sweet tea, regular colas, and the popular holiday drinks and lattes we see this time of year. But I think finally what a patient can do is talk to their physician. And their physician has the resources to hook them up with a dietitian and develop a plan with treatment options ranging from simple dietary modifications to safe surgical options.
All right, let's say you just mentioned the surgical options. Let's say somebody has done maybe all that they can on their end. When does the surgical intervention, when is that a right choice?
An ideal patient for bariatric surgery is one that has used other forms of weight loss and been successful, but has then regained some or all of their weight based upon going back to their normal. So when you look at bariatric surgery, the risk of doing nothing in obesity and those comorbidities such as diabetes and hypertension, et cetera, that far exceeds the risk associated with bariatric surgery.
Aisha, tell us about your experience with lap band surgery.
Yeah, so my reason for getting the lap band was due to the fact that obesity runs on both sides of my family, along with heart disease, high blood pressure, high cholesterol, and diabetes. And being an obese adult, weighing at about 300 pounds, was just very traumatic. And also I suffered from having little self-confidence at times. Mm-hmm. So I did some research and decided weight loss surgery was the best option for me, and I opted for the lap band. And since receiving the lap band, I do feel a lot better. I'm a lot healthier. I'm also a lot more active, and I save a lot of money on my clothes due to the fact of not having to shop in the plus size section. So it's been very exciting over the past 15 years to save lots of money on clothes because I love to shop.
And you look fabulous, and glad you're healthy too. So where can we go for more information?
Well, certainly you can talk to your physician as mentioned, but you can also go to lapband.com. And this is a comprehensive website that looks at the risk and benefits of all the procedures that are out there, but they're going to help guide you to a physician or a program that is well qualified for bariatric surgery.
All right. Thank you both so much for your time today.
Thank you.
Thank you.
Of course. If you'd like to see this segment again, just head on over to firstcoastliving.net.